on. Thank you. All righty. Hi. Oh, good. I'm glad you're on time too. Thank you for joining me. Oh, that coffee's good. Alrighty. Hi, everybody. I'm waiting for my computer to load because the print is very small, so I can't see who's talking to me just yet. Come on. Thank you. All right. Today is Thursday, April the 3rd, 2025. I'm going live because I feel like we need to chat. I feel like I need to answer questions live, you know. I think that's always best sometimes because I don't know what it is, guys. I just feel like sometimes when I do a video, I don't know why. I think I'm being clear when I say, you know, check out the description box or you go to this website or do this in the book or whatever in the book, you know. I think I'm being pretty clear, but I guess not. So we're going to talk about it today. I'm also going to talk about like what to expect in my tutoring sessions because I think tutoring is very well straightforward, but I guess other people do it differently. I don't know. So if you have a question that is not really basic, I mean, not basic, like how to get started, what do you recommend, what books do you recommend, because all that can be found in the description box of my regularly uploaded videos. But if you have a question that you want to ask, then go ahead and ask it, but just make sure it's not something really simple like how to get started, because I'm going to look at you. Hi, Dorothy. Hi, Jenny. Hi, Michelle. Hi, April. Jalisa, I hope I said that right. Ooh. I'm studying medical billing and coding. I'm actually doing some coding homework right now. Yay! Hi, Letty, doing great. Hi, Jennifer. All right. So the other thing I want to talk about too. This is what I mean when I say that sometimes people speak like they know and they don't know. And unfortunately, sometimes these are people who have like letters on their name. Okay. And let's talk about this because I had a nurse today who I was doing a frequently asked questions video for nurses, specifically nurses, LVNs, LPNs, you know, anybody that wants to get in, that's a nurse that wants to get into coding. And I guess she took offense to what I said in the video, which was, you know, don't get a degree if you want to only do coding. She said, well, I want to get a degree for me. Okay, well, great. Well, I'm an RN. Okay, well, good for you. Good for you. And she said, well, I'm taking the program and it's going to tell me all about health insurance and medical coding, all things health insurance and medical coding. And I can sit for my RHIT. But I'm going for the bachelor's program in health information management. Okay, my darling. Okay, this is how I know that you're ill-informed. Because anybody who's going for the Bachelor's of Science in Health Information Management is eligible to sit for the RHIA, not the RHIT. The RHIT is only if you are taking an approved CAHIM program, same thing with the Bachelor's of Science in Health Information Management. But if you take the associate's degree and it is for a degree in health information technology, then you're eligible to sit for the RHIT. But if you are going for the bachelor's program, then you are going to get the RHIA. You're eligible to sit for that once you've completed your program and of course you pass your test. Then you have the RHIA. But it's nurses that always seem to do this to me. You know, they always like to put in their 2 cents, and while I am totally on board with you putting in your 2 cents, I am, and I do get offended when people speak incorrectly and they're trying to like correct me. No, ma'am. No, I don't think so. So I will say this again, because I am concerned about people who go into the bachelor's degree programs for health information management thinking that it's going to help them become a stellar medical coder. If you look at the syllabus for any CAHEM approved, the Commission on Accreditation for Health Informatics and Information Management, okay, that's what I'm saying, CAHEM. If you look at the syllabus for these college programs, right, and for health information technology, health information management, you will see, if you're doing your research, you will see that the coding portion is a very small part of that program. Why? Because for health information management, that's not for coders. That is for our leaders. If you are interested in becoming a supervisor, an educator, for coders or for providers, if you want to head up a department, if you want to be a supervisor, if you want to be, it's kind of under what you should be doing because lead medical coder, that should be RHIT. But you can also do it if you have that, because there's people that don't, again, they don't understand what the degrees are for. So they demand, a degree thinking that they would need it. But if you look at the syllabus, you'll see that the majority of those programs are about human resources, leadership, the law, medical law and ethics, and statistics. That is the bulk of those programs because that is what it's covering. That's what it is for. It is not for coding. And if you think that having a degree is going to make you better than somebody who doesn't have a degree that's a medical coder, you are wrong. Because people who have degrees, again, their purpose is not to be a coder. Their purpose is to lead the flock. Their purpose is to lead everybody else. That is what they do. Do I think that people who have a degree should be really high on their knowledge of medical coding? Absolutely. Because you still have to be the person that is going to break up the arguments between auditors and coders. Okay, you're going to be the last line of defense. You are supposed to be the subject matter expert, the grand person that knows everything. That's somebody who really knows and who should have a degree. Okay, but if you're just strolling up in there, you say, oh, I'm a nurse and I have a degree in health information management, and I think that that's going to train me in all things health insurance and medical coding, you are wrong. And I don't care if you get upset about it. I'm trying to stop people from spending thousands of dollars to get educated on something that they're not even going to use. And not only that, if you're smart about it, you will wait until you get in to whatever organization you're going to get into, and oftentimes they have tuition reimbursement. You can totally do that route. So that way you don't have to spend your money. You don't have to be one of these people that I hear about on Dave Ramsey singing and crying and going on about how they're thousands of dollars into student loan debt. Oh, I have a $40,000 student loan debt. I have $300,000. What were you doing? Now, I understand, like, for lawyers and doctors, you're going to need a student loan because that's a lot of money. There is ways to pay for education, though, I believe. I don't believe in student loans, period. But again, here we go on this cycle of people thinking that they need a degree. You think you're going to make more money just because you have a degree. Well, you're wrong. And even if you are a nurse, I don't care. You still need to learn the basics like everybody else when it comes to coding. Because no, 100%, just because you are a nurse does not mean that you will automatically understand coding. I will say, though, that being a nurse is going to help you with the clinical side as far as your medical terminology, your anatomy, pathophysiology. That's fantastic. But again, there's still a lot of nurses, and you see them, they'll be making these little reels and TikToks and things, thinking it's so cute, mixing up anatomy parts, like getting confused on their medical terminology. Perineum and perineal, getting that confused. Okay, and thinking it's so cute. Well, no, it is not cute. 2, I would be scared if you were my nurse, because again, it's not funny when you make jokes about things like that. It is not funny. I would not want somebody who does not take their profession seriously to even touch me or my records. I'm just saying. So with that said, I'm just saying, and I'm laying it all out. Don't get a degree if you only want to be a coder. Wait until you've at least been in the industry for 2 years. Give yourself a couple years. And then if you decide that that's the route that you want to take, by all means, you go right ahead. but do not run into it thinking that that's what you got to do. And I would encourage even my young people, people that are just graduating high school, and you're wondering, like, what should I do? I'm thinking about doing medical coding. Do I need to go to college? No. Get yourself a certification. You can go through a school. I've talked about this several times too. You can go through a training program for medical coding. Absolutely. Do I have any specifically that I recommend? Absolutely not, because I haven't been to these schools. And people get mad at me. I don't know why y'all get mad. Wouldn't you want somebody who is honest and saying to you, hey, I don't know anything about this program, and the only ones that I have said I do recommend is directly through the associations. AHIMA has their 13 course bundle, or you can purchase the courses a la carte, right? Which means you could purchase them one at a time, which is totally fine. Then you have AAPC. They love to have their payment plan. So they have a payment plan, and they have lots and lots of packages that they will give you, right? That they have available, because I will give it to AAPC. they have their whole like selling thing down. I mean, they've got that down to a science. And like a lot of times, even for my shows and things like that, you'll see ads for AAPC pop up. You know, I don't know. But they have all of that, you know, and they have that there available. You do not have to go through a formal program, though. You don't even have to go through their training. Why? Because I made it so easy for you all, because I have the independent study syllabus literally for the last 4 months, because I have a video about it. I have several videos about it, about the independent study syllabus, right? Independent study, how to study for medical coding on your own, because you don't have to go through a formal program. You can study on your own. I talked about this last night, where you could go to the public library and get your books about medical terminology, anatomy, pathophysiology. Doesn't matter if you don't have a background in medical. I did not. But you could study that. And then I tell you what books to get, what coding manuals to get. I've done demonstrations of those videos, right? Demonstrations of like how to like look at the book and where to go and things like that. Have we done like an actual like look up this code, look up that code? No. Because a lot of it is you can navigate this yourself. I do give you guys the tools that you need to get you started, but I don't need to hand feed it every time. Okay. And what's that saying? That if you teach a man to fish, if you give a man a fish, he eats, right? But if you teach a man to fish, you feed him for a lifetime. That's exactly what I'm doing to all of you. And a lot of you don't like it. I know that. And I'm okay with it. You don't have to like it. I'm not here to make everybody like me. If everybody liked me, I would be doing something very wrong. But if you listen to my message, and you'll see, a lot of people do see it. They go, behind the tough love, Bleu, you're right. Because if I have found, if I'm really sweet and so nice and, that does not work. That does not work at all. Nothing. I mean, I get nothing out of that. As far as like you all understanding it, no. But when I'm myself and I'm like direct and this is it, take it or leave it, like it or not, then they're like, okay, something different. But all right. So let's see what we got here. Melissa, hello. How are you doing? Emma, hello. Vanessa. Hey, Kay. I can't say your name, sorry. Hi, Ruben. Shouldn't those leaders know coding though? That's always been my philosophy and why I decided to learn. Yes, absolutely. But if you heard what I said that leaders are supposed to know how to code. But that is not the reason that you get the degree. If you start with the degree before you have the certification, right? Because you think that having a degree is what you need, that's where I'm telling you that you're going wrong. Because what happens is this insufficient education in the degree programs for coding. You have to learn coding by itself. And a lot of times these employers, even if you have the RHIT, which is the associate's degree, they will tell the people, well, you still need to get a CCS. They prefer the CCS because CCS is inpatient coding and outpatient coding. So that's why I said that. I never said that the person in leadership didn't have to know coding, because yes, they do. But what I am saying is that if you are going into the degree program like that nurse, thinking that she knows and she doesn't know, going into the degree program because she thinks, oh, it's going to teach her everything she needs to know about medical billing and insurance. No, absolutely not. I'm trying to stop people from making a mistake. If you decide to go against what I just said, it's your life. You, by all means, best of luck to you. But I'm trying to save people from spending so much money, getting stuck in student loan debt, not knowing what the heck they're getting into, and then having all this money. And then you're spending years and decades trying to pay back a student loan because you didn't listen and because you thought you knew. Whereas I've been in medical coding for 17 years. I've seen it all. I've seen the shortcuts. I've seen people try to do this really quick. I've seen people try to get a bunch of credentials on their name, even no name credentials that mean absolutely nothing in our industry, to try to make themselves look better than somebody who has years of experience. But when it comes down to brass knuckles and you have to sit there and do a test against somebody even who has one credential, guess what? The person who has one credential, one coding credential, CCS, CCA, CCSP, or CPC, that person who has experience and has all this knowledge and has been building it can pass and outrun a person who has a slew of credentials, because the person who has a slew of credentials is just taking tests just to look impressive. When I see somebody with a bunch of credentials and I don't know them, I'm not impressed. I'm not easily impressed. When it comes to coding and coders, I listen. And even people who have less than a year of experience, trust me, I've met quite a few of them that I can just listen to them and know that they are super smart, that they've got it down, and that they understand it right away. And then I can listen to some of them and know that that person did not study. They are not studying. They're not doing what they're supposed to. So, again, take it or leave it. That's my advice. Jalissa says, yeah, that's my next plan, to do the courses to take the RHIT. Thank y'all for agreeing. Thank you, Vanessa. Hi, Alexandria. Me. Do you think that the reviews from 7 years ago is good to study? Do you think the exam reviews from 7 years ago is good to study for now? They talk about the 6 domains. Would it be useful to look at these before buying the books? 6 is kind of old, but if it's all you have right now, that's fine. Ruben says, I work in home health. Nurses get so offended when they try to advise on some cases for coding. There are some available online. Like I said, if that's all you have, Amy, go for it. I'm doing the self-study. Okay, Vanessa, awesome. Melissa says, you are right. I deserve at least to start educating myself for free before giving somebody else my money. Thank you. I wish I could pin that comment. Carlene says, hi, Blue. Thanks a lot for what you're doing. My pleasure. Yes, Vanessa, you need that tough love. Tough love. Thank you, Emma. Jaleesa says, I'm learning the coding is not easy, but with practice, it becomes more understandable. Yes, sometimes you just need time to take a step back and review it. And sometimes you have to sleep on it to understand it. And that's okay, because it happens. Even when I was studying for the CCS, because I needed to take the CCS. And I had gotten my CCSP, which is all the outpatient coding. And I've been in the outpatient coding at that time for 13 years. And so this was in 2021. So I had taken the CCSP, which I knew I wasn't going to have an issue with. And I had taken it in March. Well, then, of course, the channel is growing at the time. And I said, okay, well, I really do need to buckle down and get the CCS because, my audience expects more from me. And I expect more from myself, too. And so I was like, okay. So I spent the summer studying. And the ICD-10 PCS, I did have training before we went into ICD-10. back in 2014, the year before, because ICD-10 got implemented in 2015, in October 2015. So I had been on this training, but when I was in it, I was very confused because of how it was being trained to me. And the program that I was taking at home did not cover PCS. So I only had what I was doing at work for PCS. And that was confusing. I was just like, okay, I know I'm an overachiever, but this one's going to take a back seat. I'm in the outpatient side anyway. It shouldn't matter, blah, blah, blah. So after I got the CCSP, I was like, okay, I can do this. I can do this with the CCS. So I spent the summer studying, and there were many nights where I was just like, I have no idea what the heck I'm doing. I don't know this. I don't understand it. I'm going slow. And that's where I would get really frustrated because I was going slow. I knew enough to get around, but not enough that I was so quick. Not like now. Now I'm quick. I got it now. But at the time, I was still building my knowledge. Like I said, I knew only enough to get around, but not enough to like really be confident in it. So what I started learning that you can't study past 1 hour because then it's not going to retain. You're going to get tired. You're going to start getting things wrong. It's going to mess with your confidence. So it's a domino effect. So I learned that. And I learned that pens have a very far distance that they can fly when you throw them. I will not throw books, but I will throw pens. And I was frustrated because, I just didn't get it. And so some nights I had to stop and think about what does it mean? Like, what does extirpation mean? What does this procedure mean? And so, reviewing a lot of those things really did help me. And then talking it out really did help as well. So that's the thing for me that helped when I was doing that. But yeah. All right. So Trina says, I love how you are helping. Oh, my pleasure. Mimi says, honestly, though, learning A&P without prior knowledge is not easy. You want to hear a funny story about A&P? Anatomy and physiology. I had no problem with that, right? Because I was doing a quiz for my Patreons, right? I'm not trying to sell. I'm just saying, okay, this is the story. All right, listen, okay? So I did a quiz for anatomy and physiology, and then I did a quiz for pathophysiology, right? And so I said, okay, well, keep in mind, it's like 2 o'clock in the morning. And so I said, okay, I did the first one, because whenever I do the quizzes, I always put them together, and then I run through it myself so that I don't miss anything, that there's nothing that's unclear. I tried to go through it on my own, right? So I did really good on the first one. I was like, okay, yes, I got this. And then I did pathophysiology. And then again, it's 2 o'clock in the morning. So I'm going back and forth on some of the questions. And then I was just like, and all the ones that I went back and forth on, I had originally gotten right. And I had changed my mind like afterwards. So yes, it will throw you for a loop if you let it. And so I was just like, pathophysiology was what got me that night. I was like, man, but this is a good quiz though. When I put it together, I was like, okay, this is really good. I should be able to do this. So anatomy, well, that one, it was a little bit easier for me. Sometimes it's the reverse for some people. Pathophysiology is a little bit easier than anatomy. I don't know what it is. It just depends on the person. But the best thing you can do with anatomy is watch a channel like Crash Course, Anatomy and Physiology, because Crash Course is on YouTube and it's completely free. And they have subjects for everything. So if you need algebra help, if you need help with learning like the Constitution and things like that, government and policies and things like that, they have videos. They have like whole videos, like video libraries on each one of them. Anatomy and physiology, pathophysiology, they have that as well. And even they have like all these other things about government and stuff. So it's really awesome, but you can listen to it and like watch the videos. And they're shorter videos, like 8 to 10 minutes, some are 12 minutes, but it is a really good basic rundown of anatomy and physiology and of course pathophysiology. So I highly recommend that you do something like that, because sometimes that's what you need to mix it up, not just with working out of a workbook, but also watching a video as well, because that counts as study time, just so you know. All right. I saw your message, Mama Gets Fit, and then you took it away. Let's see. All right. Trina says, any advice? I failed the test once and really want to pass the medical and coding test. Okay, which test are you talking about, Trina? Letty says, don't forget to thumbs up, you all. Thank you. Thank you. Thank you, Letty, so much for reminding everybody. I appreciate that. All right. Let me take a drink of my coffee. But yes, any way that you can get other ways of learning will really help you, especially with anatomy. That's just my advice on that one. Greetings from Oceanside, California. Thank you for all the valuable information you provide. My pleasure. Wonderful, sunny Oceanside, California. I was in San Diego, which is not too far from Oceanside. But I was in San Diego in 2014. That was when AHIMA had their best conference. They had their national conference out in San Diego. And that was my very first conference that I went to for AHIMA. And I've steadily gone ever since then. But of course, after the pandemic, I didn't go because, of course, they were in weird places. And then Baltimore was my first one back. And so it was pretty good. And the only one I had missed before then was the one out in LA. I won't go to the LA one. But San Diego was a lot of fun, just saying. April says, can't wait for that quiz. I'm on the pathophysiology part right now. I hope you have better luck with it than I did. And whatever you do, don't second guess yourself. Because I felt like, man, I was like, really? I had to second guess myself. But I know that I need to remember some more of those things. Because anatomy, I see that all the time. But it's the pathophysiology that was throwing me off. So I'm going to make sure I do some more of those. Hi, Nadia. Greetings from San Diego then. All right. California is representing tonight. But yes, that conference was good. I mean, that was San Diego was the best conference. Whoever did the committee that they did the conference out in San Diego. I hope I didn't say San Francisco. I thought I said San Francisco. San Diego. It was really awesome. I mean, they had Casey and the Sunshine Band, and for you young people, they were before my time too, okay? But I really do love Casey and Sunshine Band. I have very eclectic taste in music, and so I listen to everything. And because I listen to everything, Casey and the Sunshine Band was really awesome. We were out on the Padres field. They had fireworks for us, and then they had like this really awesome spread, like they had, the bar and everything, and they had drinks and, sodas and whatever you wanted. I mean, it was just amazing. They went above and beyond with that one. And then they had Rob Lowe as one of the guest speakers. So it was really amazing. And then I think my other one that I would say was really amazing was when I went to Miami for conference. So they had astronaut, or should I say now, I think he's Senator Mark Kelly, Arizona, but he was astronaut at the time, Mark Kelly. And I was excited to see him because, of course, I'm a freaking nerd, and so I love that. Gloria Estefan performed for us as well. It's one of the morning sessions. And that was really awesome because I grew up listening to Gloria Estefan and I loved it. I was just like, living my little kid dream of seeing her in concert. I never thought that would happen, but it did. And so I was like, oh, this is so much fun. But yes, it was that conference was a lot of fun. And of course, the mojitos. I mean, that's like the home of the mojito. So in the hotel that I stayed at, there was like a little restaurant and bar grill there. Oh my gosh, it was the best. Literally the best. And the guy was like, can I make you my peach? He made a peach mojito. I don't know how he did it, but he did a really good job with it. I was like, Ooh. No, I only had one because I'm a lightweight. Okay. When you are a former bartender, like myself, a bartender typically will not drink. They'll taste, because you got to taste your drinks, right? Got to make sure that you're making it right. But I don't drink a lot. And so again, lightweight. But after that one, I just stood up. I was like, oh, okay. This is a really good drink. And I went home and I went to sleep, but that was so good. It was a lot of fun. Of course they had the white party out there. The white party was amazing. Of course I had this really long white dress. It was really awesome. So, but yes, memories. What college should I attend for the CCA? Joke. Does this live count as study time? Did you ask me that last time? Somebody asked me that if my shows count as study time, if you want to. If you wanted to. But yes, okay, so what else was I going to talk about? Oh, okay. So, tutoring. For those of you that are going the self-study route, or maybe you're in a coding program right now and you say that you're not getting any help from your teacher, which is common, right? This is not unusual because sometimes these schools, they overpack the courses because a lot of times you'll start out with like 60 people in the class and then at the end you've got maybe 10. Sometimes you have 5. Because people drop out. They get frustrated because it's not something that they can learn right away. Okay. And so then they feel like they have nobody to help them. So I do offer tutoring. I'm just letting you all know. Okay. Again, I am not selling. I am letting you know because a lot of people want to know what is included in this tutoring. Because some people think that I will put together like quizzes for them. This one lady was like, oh, can you quiz me on medical billing, diabetes, and pregnancy, right? And I told her, I said, I'm letting you know up front, I am a medical coder. I'm pretty clear on that on the channel, but I am a medical coder. I do not do billing, but and I don't put together quizzes. What tutoring is that I do is we meet over Zoom for 1 hour. Okay. I do not book appointments for less than 1 hour. Okay. You have to book a minimum of 1 hour. Okay. And we meet live over Zoom. It is just me and you. And we go over whatever questions you have, because I think that's the best way to make use of your time. This is your hour with me. There's nobody else here. So if you have something that you specifically are getting stuck on in school, okay, because I will not help people who are out there who need help with their assessment tests for work. No, ma'am, no, sir. No. That is a test of your knowledge and skill, not a test of my knowledge and skill. Okay. But if you are in school, I can explain things, right? We can go over your question, go over your problem and things like that. And I can explain other things. Maybe you need something expanded, like explained in more detail. And that's totally fine. That's what I do. So that's what I do. And the lady was like, well, I'm in school. How did you study for the CCSP if you can't explain billing? Okay, ma'am, you're talking about being in school. You just said medical billing. Now, I've had billers come to me and say, Blue, I'm a biller, and I don't really understand what these denials mean. I don't do billing. I do coding. And I think I'm very clear on that, And so that's what I thought she was talking about. Like, okay, I'm getting stuck, on billing. I don't do billing. Okay. And I said, ma'am, that wasn't what you said. What you said was you wanted tutoring quizzes on billing. I don't do billing. Now you're asking me about, because you're in school and you want to know how did I study for reimbursement. Reimbursement is different from billing. When I tell you I can't explain things about Medicare and like Blue Cross Blue Shield and Aetna, because they all have different things. I know some things about Medicare, right? But not enough that it's going to be enough for, oh, yeah, you do this in billing. No. And so that's why I told her, I said, there's a difference between billing and reimbursement, and you are not clear. And she's like, oh, okay, well, what do you recommend? So all the resources, again, that we talk about in the description box, all the books, right? Not on the live description box, but on the regular videos. You know, study tips for the exam, CCS, CCA, CCSP, or CPC. I give you all of those things, and she's still asking me, "Oh, what do you recommend?" So Melissa says, I have been a medical assistant for 15 years, and I have an interview for a patient account for an inpatient facility. Should this give me experience that will help for coding? That is the number one job I tell people to avoid. That is the number one job I tell people to avoid. It will not help you. Patient access will not help you. In fact, it will only wear you out, because patient access is patient facing. Okay, you have to work with these patients. Okay, coders don't, and you're not working with any codes. You're looking at medical documentation to pick out and extract codes. You're not doing that. So all of your skill that you're building up right now in coding, you will not use that when you are in patient access. Not only that, if the hospital likes you for a patient access individual, and there's an opening for a coder in that facility, and they like you there at patient access, guess who's not moving? And guess who HR is going to be taking care of? Not you. They will be taking care of the organization, if whatever the organization needs. And they need you to be in patient access, especially if the patients really love you. You're not going anywhere. Okay, you are not going anywhere. You're staying right there. So that's why I tell people all the time, don't waste your time in patient access. Don't waste your time. Do not. And I have posted that specifically on my LinkedIn too. And I had to block a couple people because they thought they were smarter than me. No, absolutely not. I don't want people wasting their time in a position that's not going to help them. If you apply right now for medical biller, that's something good, because even if you're in school, you can still apply for medical biller. Medical biller will at least give you exposure to the codes and exposure to the electronic health record, right? Prior authorizations, again, exposure to the record, exposure to the electronic health record, and then the doctor's telling you, I want to perform this procedure on this patient who has this condition, call the insurance, see if we can make it happen. So that, again, is exposing you to the codes. So that's going to help you. That kind of position will help you. A position in charge entry. Charge entry will not get you coding practice, but it will get you exposure to codes. And that's what you need, right? You need exposure to codes. You need exposure to the electronic health record. That's what it's doing for you there, right? With charge entry. Claims reviewer. You can work directly with the insurance company like Blue Cross Blue Shield, Aetna, any of those big guys, right? You are the person that they're sending the claims to. You're doing the claims review. Not claims review to approve a procedure, but claims review like, hey, this is the doctor, he did this on this patient this day with this E&M level, and then you are running it through an encoder. You're looking for things that are coming up as errors to deny or approve this claim to get paid. Guess what that is doing? You are not only looking at codes that are already coded, but you're looking for errors. You're looking for what is right. And then you have that knowledge of what is right and what is considered correct coding when you're working with this insurance company. Well, guess what that's doing for your resume? It is filling it out, okay? And a lot of times you don't even have to be certified to do that, to work for the insurance company. So if you stroll up in there and you say, hey, I'm a certified medical coder, or I'm in medical coding school, and you put on your resume all the things that they need for that particular position, guess who's going to get experience now? And not only that, guess what it does to these employers when they see that you're coming over from the insurance side? This is somebody who knows Blue Cross Blue Shield inside and out. We need somebody who has experience with Blue Cross Blue Shield. We need somebody who has experience with Aetna and what it's like to work with them. Catnip for these for these employers, okay? So just saying, just putting that out there. But like I said about the tutoring, I know I jumped from one thing to another, but I got off on the other thing because I saw the comment come up and I wanted to answer it. But to finish what I was saying about the tutoring, when we meet, we go over your specific questions. Like I said, I don't write out quizzes for people because I don't know if that's what you need. And you're the one who's needing the help. So that's why you come to me with your list of questions so that way we can go over. And I have coding manuals so that I can go over it with you and go through it. Okay. So that is what I do in the tutoring sessions. All right. And now, again, my schedule gets very tight. And that is why I am very firm with my times. So when we set up a time, whatever, that's the time that we have. If you need to reschedule, my reschedule policy is if you reschedule greater than 24 hours before your appointment, you can reschedule one time only for free. If you try to cancel at the last minute, oh, something came up. It is anything after or within 24 hours of your appointment, or if you miss your appointment because you forgot, that's a $25 rebooking fee. Because I have found that if you allow people to waste your time, they will. So no one will waste my time, especially because my time is in demand when it comes to my appointments for tutoring. Because I do have people who book weeks in advance because they need somebody to help them. Well, again, it's me and you, and we're here to work it out. So that's what I do. And the rate and contact is in the description box below. I'm just saying. So that is something that you can do to kind of supplement, your learning and things like that. I will not meet with you ahead of time. I've been asked that too. Can we meet prior? Can you call me on the phone so we can talk about my needs? Absolutely not. Absolutely not. Because tutoring is based on the whatever it is that you need help with, school or whatever, or the coding problem that you need help on. If it's professional coaching, it's the same thing. I'm not going to meet with you beforehand. Okay, because that's more of my time, and that's time that could have went to somebody else. Okay, so no, absolutely not. Your time is your time. Professional coaching, what is that? Professional coaching is anything like sometimes people will tell me, Blue, I want to do interview prep. Okay, so we do that. That's professional coaching. For the first half hour, we will run through questions. I will ask you questions. I will look at your responses. I will look at your body language. I will expect you to be dressed like you would for an interview. I will expect the background to be clean, nice. I don't want all that noise and distraction because that's exactly what I'm judging you on as well. I will ask you generic questions, but questions pointed enough, obviously, that you're going to be able to get prepared for whatever, the place is that you're applying at. And then in the second half of that hour, we talk about your results and we talk about like what you can do to improve. Okay. Because sometimes that's what you need. Sometimes you just kind of need to run with that just a little bit. And then we talk about those sticky questions like, what would you do in this situation? Or what did you do when you had a problem with a coworker? What is your biggest weakness? We talk about those questions. So that's something that I do for professional coaching. Sometimes the professional coaching is Blue. There's so much information. I know you broke it down about the independent study, but I need you to go over it with me. Okay, that's the same thing. Coaching. Okay, we go over all your questions. A lot of times I have given people like links and things like that to kind of help them as well. So that way they can, run free, run free birdie, they can learn to fly. So, but that's what I do, and sometimes people who are studying on their own will book with me every week until they get comfortable and then they break it off to every 2 weeks. Sometimes people will book with me once a month to kind of check in and help them and like, okay, yes, I had all of these questions and I wrote them all down. That's what we do in that too. Okay. And if you're interested in the resumes, I will say this. Okay. So resumes, this is not Burger King. I am not Burger King. Okay. I am not Burger King. But your resume is going to be customized to you. Okay. The max it can take is 7 days from the time of our meeting to the return. Okay. Sometimes it's returned a little bit faster than that. I give myself that 7-day window because I am a writer. That means that I am not going to automatically think of things. Things have to come to me. We meet for 30 minutes. The 30-minute meeting is included with your package. You get a new cover letter, a new resume, and that 30-minute meeting. You have to be at the 30-minute meeting. This is not a negotiable, because I'm not going to sit here and go back and forth with somebody over email about what you did, okay? This way we talk about exactly what it is that you want for this resume. You tell me all the things that you want for this resume, because you're only getting a one-page resume. Every resume that's been successful, yes, I've done 2 pages that were successful as well, but for the most part that I've seen for new people, it's just cleaner when it comes out on 1 page. So we talk about your needs and wants, what kind of position you want to apply for, and what are the things that you did in your past. Because sometimes people tell me, Blue, I haven't been working, but then they have all of these things that they've been doing. This one, she was a stay-at-home parent. She says, Blue, the only thing I've done is work on the PTA. I said, that's fine. So I wrote down PTA, and I wrote down all the things that she said that she did, helped out with the boosters and did all these things and did cash handling and, handled all these other things and kept these things organized and made lists and did all these things. She got the job. And that was the only thing she had on there. Of course, being a parent, but being in the PTA. And she said that they were so impressed that she was in the PTA and that she wrote that was why she ended up getting the job. But of course, she took the assessment test and she passed really well. And I knew she had it in her because I was just by talking to her, I was like, okay, and she didn't quite believe me. She didn't quite, I don't know. She's like, I don't know, Blue, PTA. And I'm like, don't worry, I got this. And so I wrote it. Sure enough, she got the job. She's like, I got the job. And I was like, congratulations, I will never guarantee my resumes, but I will say that it is customized to your skill level and what you're bringing, okay? And sometimes we don't think about all the things that we do that could be helpful in transitioning into this career field, okay? Because not everybody's coming over from a medical background. I didn't, And so that's the thing that we do there. And yes, it can take up to 7 days. A lady was real smart with me, and she says, well, it's already done. It shouldn't take 7 days. Okay, ma'am. If it's already done, then why are you contacting me? And her resume didn't look great either. I'm just saying. So sometimes I'm not using any of the information other than your work history and where you worked and stuff. And then we work out what it is. The reason that we have this 30-minute meeting is to nail out what you want. I do not go back and forth. There are no revisions. There are no, adjust this, add that. No, absolutely not. Because if it's not on there, we don't talk about it. No, I'm not adding it. And I'm very clear about that. Because you're coming to me for help. And I take that very seriously. If you could write the resume, then obviously you would do it. But I don't want people thinking that they can sit here and go back and forth with me. Absolutely not. You're not wasting my time. Because I'm not wasting your time. I want you to get out there and succeed. I don't want you to sit here and say, well, let's add my awards. For what? They don't care. These employers don't care. They want to know right away what it is that you're bringing to them. What can you do to help them? Because it is about them in the beginning. Then, of course, when you get in, it's about you. But in the beginning, it is about them. And you have to understand that. So that's why I say there are no revisions and there is no refunds. Because, again, you're not wasting my time. Okay? And so that's what I'm very firm on when it comes to those resumes. All right? Now, there's a lot of feedback out there about my resumes. It's very good. So I'm just saying. But I've given plenty of tips on the videos too. So you don't have to even book with me. You can go and help yourself and look at those resume tip videos. You don't want to look through all the videos. Just Google Medical Coding with Blue resume tips. And you'll see all my videos pop up. Okay? So you can go directly there by going to Google. All right. Yes, medical biller is a good starting role. I just said that. Let's see. What am I going? Where am I at? Do you think watching different procedures on YouTube will help me? It helped me. Trina, you're the one who you failed your test? You failed the CPC test, Trina? Are you studying for 20 hours per week? Any advice since I failed once and I want to pass? Are you studying 20 hours per week? Are you using the CPC study guide? Are you using the Nellie Leon Chisholm book, the ICD-10-CM? You could skip the ICD-10-PCS questions, right? ICD-10-CM and ICD-10-PCS coding handbook with the answers, okay? You use that to study. Okay, you use those 2 books to study, you work through those whole thing, the whole thing, then you'll be good. Okay, but if you're not doing that, if you're spending less than 20 hours per week studying and practicing, if you're doing 5 hours because that's all you think you can fit in, then you get the score that you get. Unfortunately, you get the score that you get because this takes time. You have to practice. You have to practice. There's no getting around it. There's no process of elimination because that's crap. People who do process of elimination to skate their way, not saying that you are, Miss Trina, I'm not saying that. But what I am saying is people who look for those types of things to help them get through those tests, those are the people who are not going to be ready for the real world. It is going to be even more scary and more worrisome when you get out in the real world. But if you're preparing yourself now, you're going to be so confident when you go out there in the real world. But what I'm saying is make sure that you're studying 20 hours per week. That is 3.5 hours per day, 5 days a week. 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon. You could be listening to something, anatomy, physiology, your medical terminology, your coding guidelines. You could be reading those as well, right? And then you get home, you take care of the kids, do whatever you got to do. You study for 1 hour worth of workbook, you work through those word problems, and then you take a break, and then you come back, you study for another hour. That's your 3.5 hours. You do that in 5 days, that's 17.5 hours. And then all you have is 2.5 hours on a Saturday or Sunday. And you stay like that, and you practice, and you practice, and you practice. And you do this for 3 months to prepare yourself to get those 90 days in, you will be ready. You will not fail that second time. I can't guarantee it, but I'm just saying you'll be even more prepared than you were when you came in the first time. And people have told me, Blue, you were right about the 20 hours. It works. It works because you're putting in the time and practice, and you're getting more proficient with your books. You see my books back here? Do you see any of them tabbed up? Heck no. Heck no. And people who tab up their books, then they tell me, well, Blue, I failed. Well, did the tabs help you? No, absolutely did not. And you waste your time doing that. You waste your time tabbing books because that's not helping you get the practice. Actually, looking up the codes would help you get practice. I'm just saying. Melissa says, it's not a patient-facing patient access. It is patient accounts representative. The job description states it's billing and insurance verification. I did patient access. 1 year was enough. Okay, honey. It's billing. So you don't think you're going to be doing any, it may not be patient facing like literally, but you don't think you're going to be on the phone trying to help these people to set up a billing plan for their balance, because they're not coming in with no zero balance. They may have some bill that was left over from the last time that they were admitted or whatever, and you're the one who has to call them to get on a payment plan. But again, if you want to do that, you go right ahead then. You go right ahead. That was my light because it was plugged into this other one. We're going to leave it off. Springy? What about pharmacy technician? Nope. To do? No. Oh, you're coming over as a pharmacy tech. A lot of people have. I've done resumes before for people who were pharmacy tech and they've transitioned well. Think about all the things that you did. If you worked as a pharmacy tech, then I know you got a lot of HCPCS experience because, of course, they do like the codes for like, some of the injectables and things like that. So that's something that you want to make sure that you highlight on your resume. Any kind of diagnosis codes you saw, any other medication codes, those HCPCS codes, you want to make sure that you put that on your resume. Absolutely. Vanessa. Okay. All right. Good. Piney says, I got my first coding job. Thank you for all your videos. Such a wonderful help. Well, congratulations. That's awesome. Yeah. Okay. But yes, Trina, that's what I would recommend for you since you say that you failed. Make sure that you study. That's the only thing. I mean, there's no book. There's no training boot camp. There's nothing that can help you to pass a test if you are not putting in the time. There are lots of like, oh yes, we're the test prep boot camp and all this other stuff. They have that out there. And while that's helpful, so for some people, if you're not putting in the work, it will not help you. Doesn't matter what the person says that their passing scores is, because I've had somebody before that They messaged me. It says, "Oh, we have 100% pass rate for our test prep." No, ma'am. No, ma'am. Not even the best tutors will have 100% for their from their students, because somebody's always going to mess up, because there's always going to be somebody that lets their nerves get the better of them. So that was a lie. That was a lie. And you're not going to impress me trying to lie. Okay? I don't believe it. There's not one thing that would be 100%. There's always going to be somebody that's going to mess up that 100%. And it's due to nerves, it's due to their community, their environment around them, because not all students do tests well. You can hope for the best, you could try to prepare them as much as you can, but it's a lie when you say that 100% of those students that go through your program pass. That's a lie. That's a lie. I'm just saying. So, but yes, taking it seriously and making sure that you are preparing yourself. You're not cramming, which, like I said, if you're doing it the way that I've been telling you all, 1 hour at a time, 30 minutes minimum, right? You do 30 minutes, 30 minutes, 30 minutes, and then 1 hour and 1 hour. Okay. And then you take your breaks in between. Going for long stretches of time, it does nothing. You don't retain anything going 8 hours. Somebody told me, "Oh, I studied for 8 hours and I have a headache." You earned that headache. Do it again so you can get another headache. Maybe that way you learn, I'm just saying. How about using the pocket prep practice for the CPC exam? What are your thoughts on the pocket prep? I don't know what pocket prep is. All I know is a CPC study guide. That's what I know. Do I recommend these little gimmicky things? Sometimes, like, you see them, like little gimmicky things. I don't even know what the pocket thing is. I never heard of that. All I know is that CPC study guide is awesome. And you can use that to help you do practice, And it covers almost all those domains and everything in there. And it covers everything, really, that CPC study guide does. So that's what I would recommend, hands down, before anything else, because it also has the answers. Okay, good. I have the 2025 study guide. Good. Use that. You don't need to get anything else. Just use that. Just use that. That's what you need. Okay. I do recommend getting you some diagnosis practice. Okay. If you want to get anything extra, I recommend the Nelly book, the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by Nelly Leon Chisholm. That is the best for learning diagnosis coding. I know that AAPC, there's only a few diagnosis questions specifically, but of course there's diagnosis questions on all of the other scenarios that they have and stuff like that. But specific diagnosis questions, there's only a few. Doesn't mean that that's not something that you need to not work on. You obviously need to work on that. Anybody that is strong in diagnosis coding and strong in procedure coding is going to do well, okay? Because that's going to be the bulk of your test, is your coding knowledge and skill. On any of the 4 main medical coding certification exams, that is the bulk of the exam, is your coding knowledge and skill. If you have that, if you don't have that, you have nothing. You have nothing. And people will get spun up about, "Oh, well, what about reimbursement?" Well, there's reimbursement books out there, but like I said, if you would take time to go to the Medicare Learning Network, you can Google Medicare Learning Network, and you will see all these things about reimbursement. You will see things, articles, and everything else when you go to the Medicare Learning Network. And there's also booklets that you can download, and they're free. The Global Surgical Booklet is one of the ones that I really do recommend, okay? And that's going to be talking about your 0-day global period, your 10-day global period, your 90-day global period, and what all is included in that. There's a lot of things you can learn on there. There's even one about physician documentation and things like that. So that's also really good for you to study as a brand new medical coder. But learning about RVUs and, all those other things, those are things that can be found on the CMS website, cms.gov. And you can go through and find the frequently asked questions. You could look the little search box, you could put in RVU, you could put in anything that you're looking for, and you'll see, all of that stuff as far as, those types of things. As far as a billing book, an actual billing book, if you want to get an actual billing book, I'm pretty sure AAPC has a fantastic billing book. If they've got a fantastic study guide, that would be what I would recommend. I haven't seen it though. Just keep that in mind. I haven't seen their reimbursement book, but I'm just saying, if you absolutely have the itchy trigger finger, you want to spend money, then by all means go ahead and do that. Look at the reimbursement book from there. But other than that, and no, I don't recommend getting the CPB. CPB, certified professional biller. Now, sometimes people will say, "Well, I'm a biller, and that's all I want to be." If that's all you want to be, and you run a business, that makes sense to me. It makes sense to me because reimbursement is basically all you're looking at, but you still should know coding, and it's not required for billers to know coding, and that's a bad thing. I think I think somebody who knows both billing and coding would be even better, but what do I know? But with that said, with billing, and billing is such a small portion of the CPC test too. I mean, it's on there, but it's not as heavy as the coding part. Okay, so just keep that in mind. But you still do need to know it. But again, a lot of these questions can be answered on the CMS website. All right, Jade says, I had my medical billing and coding, my medical billing and coding class 2 years ago, and didn't realize they had us register for the CCA. Do you think it's a good idea to try for the CCA first and then get the CCS or the CPC? So don't act like the CCA is a bad credential to get. I had that for 13 years. You're looking at the number one advocate for the CCA, okay? I love the CCA. And people who talk crap about the CCA are ignorant. And I will tell them that to their face that they are ignorant, because CCA says that you have the entry-level competence of inpatient coding or outpatient coding. And again, I had it for 13 years. I still have it today if AHIMA would let me have it, but they won't, okay? So with that said, do I recommend that you start with CCA? Absolutely. It's a shorter exam, but it does pack a punch because you still have to know inpatient coding and outpatient coding, okay? But if you only really are comfortable with the CPT side and you only really want to take, but if the school has you register for the CCA, go ahead and prepare for it and take it. And then if you want to take the CCS afterward, you can. I mean, do I think that you need to take the CPC afterward? Absolutely not. Absolutely not. Because again, that's going to be more money that you're going to be spending, and you're going to be half doubling the credential because the CPC only covers outpatient. But with the CCA, it says inpatient coding and outpatient coding. And if you say, well, with the CPC, I could, be a CPC. Okay, well, you still have to have the apprentice status for the 2 years unless you pay more money, get Practicode, and then finish Practicode. And then if you're going through a formal program of theirs, then they'll take the apprentice status away. If not, you're still an apprentice for a full year until the year that you're working, you get your first job in coding, you'll still have the apprentice status. So again, why would you be doubling up? Because it's 36 continuing education units for one credential with AAPC. Not only that, you got to pay the $222 fee every single year, the membership fee. You got to pay that every single year, and with AHIMA, you don't have to. They give you the option, right? And their minimum membership dues is $149, and then they have a $209 premier level, but that's not for you if you are brand new and starting. You can get $149 and still get really good benefit out of it. But again, it's 36 for one with AAPC, that's CPC, but with AHIMA, it's 20 for your CEUs. So think about that. And yes, while they do give you a lot of CEUs with AAPC, still, that's a lot of upkeep. I'm just saying. And then you're going to try to double them both? It doesn't make sense, just saying. All right. Ooh, Estella, no, not that book, not that book, not that book, not that book. I have that book. I have a few of the Bucks books. I do not like them. I don't. Other people may have had good experiences with them, but I will say, I feel, this is my opinion, in my opinion, Bucks books are written by somebody that knows coding. And the way that they wrote it, they're speaking to people who already know how to code. But if you're brand new, it does not make sense. That's my opinion. Okay. Some people learn from it. But I'm telling you now that if you have the funds to find the Nelly book, right? The ICD-10-CM and ICD-10-PCS coding handbook with the answers. You can even try to go to the public library and see if you can check it out over there. Because like if you live in a bigger city, you may be able to find it. Okay. But that Nelly book, there's such a night and day freaking difference between the Nelly book and the Bucks book. Night and day. And that's why I always pair the two. I pair the Nelly book and the CPC study guide, and that's good enough versus that Bucks book. Because again, it's I get confused, and I've been a coder for years. You know what I mean? So just a little advice there, Stella. You know, but yeah, that's my advice anyway. Rue says, "What is CMS?" Google it. Estella says, I work as a biller now, but in the process of working towards CPC. Okay, good. Jade says, thanks, Blue. Love your positivity. Have a great night from Ohio. Okay. The Nelly book is that correct? I'm gonna put it in here, right in here in the chat. The title of it. So they have, and you could get up to like the 2022 version, right? 2022, 2023, 2024, 2025. Any of these is good enough, okay? Because some of the codes have updated, but not all of them. And it's virtually the same thing as the 2025 version. But get the one with the answers, because they have one without the answers, okay? They have one without the answers. So, you don't want that one. You want the one with the answers. But that is the book. And the author is Nelly Leon Chisholm. Yes. Alrighty. So does anybody else have any other questions? Okay. But yes, sorry, Estella, I had to tell you about the Bucks book. I have never seen your name before, so I know you're new, but I'm just saying that a lot of people know my feelings about the Bucks book. All right, so okay, well, this has been a lively conversation. I feel like I've been talking nonstop. What am I at? 1 hour and 8 minutes. Okay. All right. I got it as part of the course I took. And that's the problem. A lot of these schools have that same book. A lot of these schools have that same book. So they use that one. And then, like, when I had a lot of students coming to me the first time with it, I was like, oh, no. This is why. Because sometimes, like, the tools that you use can make a world of difference. Like when people have like another publisher of ICD-10 CM, right? Because Optum is a publisher. There's Elsevier, the AMA, AAPC, AHEMA. They all have their own versions of ICD-10 CM, right? Different publishers, right? But as far as the best one, in my opinion, has to be Optum. And the reason that I say this is because if you saw my video earlier in the week, I did ICD-10 CM breakdown. Like I opened it up and I was showing you guys like, okay, this is a 2025 ICD-10 CM book, right? And then I showed you in there where they have before in the tabular section, right, where all the codes are at, before every single chapter starts, they have the chapter specific guidelines, right? And then they have examples, coding examples throughout. And then you could cover up the answers because they have the question, they have the answer, and then they have the rationale. If you cover up those answers and then you look up those questions throughout the whole book, that would mean that you have gone through almost all of the chapters and coded every single thing from every single chapter. So at least this way you can understand like where you're having a problem. If you're having a problem coding for ortho, but you don't have a problem with gastro coding, you don't have a problem with neurology coding, you're totally fine there, then you know you need to work on ortho, right? And that's the only way that you can kind of figure that out. And then meanwhile, in between time, you could be looking at those guidelines, right? In the specific chapter. So that way, that's going to help you to learn it. That's the only way you're going to be able to learn it and truly be competent when you get out there. Because that's why, and I'll say this and I'm going to wrap it up. Because I'll keep going. But that's why a lot of these employers don't want to hire brand new people, because they know that a lot of these schools are unregulated, right? The trade schools and the temp schools, things like that, they're all unregulated, and so there's no formal syllabus. There's no formal thing that you have to have this type of training, this type of training, this type of training. And so because of that, a lot of people will get cattle herded through these fast-paced medical coding programs because they have some salesmen in there who's not even certified and say, oh yes, you can learn everything you need to learn about medical coding in just 2 months. You could be on your way to a high-paying career. Okay. And then they lie to my nurses and they say, oh yes, you're a nurse. Oh, even better. You're going to be, this is a few weeks for you, 6 weeks, and you could be on your way to a coding career. Get out of here. Really? But it happens. And then what happens is a lot of times these schools will teach the people how to pass the test. Why? Because if we have a multiple choice test and we teach you how to pass the test, oh, we have a really high pass rate at our school. We're really proud of our program. Meanwhile, how did they get to that high score? They got to that high score because they taught the people how to do process of elimination, not really teaching them the fundamentals of critical thinking, right? And whereas I will tell y'all to critically think, I will show y'all how to critically think, I will give y'all the resources, and then I get people who want to get nasty with me because of it. I don't care. Because the people who do pick it up and who do understand it and who do get out there and who are competent, those are the ones who find jobs. Okay? So the reason, again, these employers don't want to hire people because they say, yeah, they're certified. They have their certification. And then when they get in there and they start coding, they have no idea what they're doing. And then instead of somebody helping, and they just hired them and they pick up the slack and everything, because it's very expensive to hire coders, because you have to go through a background check. You got to do a tinkle test. And if you don't know what a tinkle test is, figure it out. But you got to go through a tinkle test. You don't think all those things take time? Takes time, takes money, takes a lot of money on the organization to be able to get these people and screen them and to be able to pass them and get them in. And then they got to wait for another 90 days while you're on probation, right? To be, into the system and to learn the system and things like that. So there's all of this time wasted. The thing that will get business the most, anybody in the working world, anybody in the business world knows this. Time is what gets business, because that is more expensive than the money. Money, a business can make up. They cannot make up lost time. So that's why they say, we don't want anybody that's going to come in here that's incompetent. We'll hire somebody with years of experience, not knowing that a lot of times those people with years of experience, some of them stayed in the same clinic for years and years and years and never did anything else. And they have less knowledge than somebody who's brand new coming in, who has trained well, who has followed my advice. But they have less knowledge than somebody that's brand new. But you wouldn't know it because they have years of experience. And they're going to say, well, they've been around for a long time, so they'll be able to pick it up. Not always the case. Not always the case. So that's why I tell people, my brand new people, make sure that you continue to study. Make sure that you continue to study right, and that you practice. So that way you can actually, when you're out there and you're taking these assessment tests, you'll be able to get in. Because it's the people that are practicing and putting in that time, those are the people that eventually get picked up. Okay? Is it going to happen overnight? No, because that's the way that this industry is. But it doesn't mean that, our future leaders can't change that. It doesn't mean that, But we all have to start getting on the same page. We need to get on the same page about what is what, and of course, learning and things like that. That's a big part of it. But having competent coders is exactly what the industry needs, not people who are here just to try to collect a check and go home. I'm just saying. So, all right. I'm going to go ahead and wrap this one up, but I will see you guys back on Monday. If there's any shows that y'all want me to do, let me know. Like, not really basic shows, basic, like how to get started. But like any other show ideas y'all have, put it in the comments. Like, subscribe, share. I really appreciate it. And I'll see y'all next time. Bye.